Shalom. Before I begin this lesson, I want to give all praise, honor, and the glory to Yahweh, Bahashem, Yahweh Shai, Bahashem, Rakah Kwadash. Double honors to the elders and the apostles of Great Millstone that rule well, and peace and blessings be multiplied on all you brethren, teaching this word in all sincerity and in truth. And to the few Akwaf that listen and subscribe as well. It's your brother Dama Hagabar, here with another lesson, Lord willing to edify and give you warning from Yahweh, Yahweh Shai. And as you can see from the title of this article, drug shortages near all-time high, leading to rationing. And as we know, this is going to lead to massive amounts of death, pain, and suffering, and depression, and desperation, anger, hey, this is just more of it's going to lead to more depression, more anxiety, and even suicides, man. Which shows you that very fearful and very dreadful times are coming here to Babylon the Great, aka America, in the near future, man. And this is just another another thing to add to the list of shortages which is happening here in Babylon the Great. On top of the drug shortage, now you can add this drug shortage to the list of food shortages, chicken shortages, and all the other shortages that are going on here in Babylon the Great as this place rears its end. In which we know some of these things are being attributed to the manufactured famine and scarcity, and the elites, looking to bring, to add more fuel to the order out of the chaos, man. And one thing that you can definitely count on bringing more chaos is, these different drug shortages. Excuse me, because a lot of these Americans are dependent on these drugs, man. And a lot of people that are sick depends on all these different type of drugs that they're having shortages on, as I'm going to show you in this article, which is ultimately going to lead to death, like I said, and depression, anger, frustration, depression, suicide, pain, and suffering, man. Because there's not a lot of good things coming here to Babylon the Great in the near future, and this is just another one on top of all the other shit that's happening. So I'm gonna read some of this article. Got a precept, and I'm gonna close it. It says thousands of patients are facing delays in getting treatments for cancer and other life-threatening diseases, with drug shortages in the United States approaching record levels. And we know that there's a huge agenda by these elites to do away with a lot of the population. And there are a lot of sick people here in Babylon the Great. There's a lot of people with cancers, a lot of people that are getting sick, a lot of people that have been sick, and a lot of people who have recently taken that thing as of a couple of years ago, which, has been amplifying the cancers that's already inside of people. Is amplifying other sicknesses that were already maybe laying dormant within you. That stuff that people was taking is actually accelerating it and activating it, so which a lot of people are randomly just dropping dead and getting sick and getting cancer all of a sudden. And now there seems to be a shortage of these life-threatening a lot of these treatments for these life-threatening diseases, which is going to cause a lot of death, man. And like I said, there are a lot of sick people here in Babylon the Great. This is not a healthy nation here. People are on all type of shit, all type of drugs for pain medications, depression, anxiety, cancer, other life-threatening illnesses. So can you imagine when these drugs are no longer able to be found and people cannot fill these prescriptions for these life-saving drugs, the effect and the turmoil and the desperation and the death is going to cause is going to be unprecedented. It says hospitals are scourging shelves for supplies of a drug that reverses lead poisoning for a sterile fluid needed to stop the heart for bypass surgery. So can you imagine all these people who need surgeries, who need these different treatments, and they're not going to have the drug to be able to give it to everybody? How many people are going to be just left not on the, are going to be left off the list to receive these particular drugs because there's shortages of them? It's going to lead to a lot of death, man. It says some antibiotics are still scarce following the winter flu season, when doctors and patients frantically chase medicines for ailments like strep throat. Even children's Tylenol was hard to find. Hundreds of drugs are on the list of medication in short supply in the United States as officials grapple with an opaque and sometimes interrupted supply chain, quality and financial issues that are leading to manufacturing shutdowns. The shortages are so acute that they are commanding the attention of the White House and Congress, which are examining the underlying cause of the faltering generic drug market, which accounts for about 90% of domestic prescriptions. Well, anybody with some sense would know that they're being brought out and they're being shut down by these elites, all right? Because they don't want you people, to receive these different treatments and ailments. Remember, they have a huge plan to get rid of a lot of you people, man. How easier would that be? Than to manufacture a lot of these shortages, which, not all of them are manufactured, but I'm sure a lot of it is. This is all part of the plan. This is all part of the plan of the New World Order to get you people to be so desperate and then so in need and so fearful and so just destitute out here that, you'll go to the government, for the want of all things, even, putting that charagma inside of you. It says the Biden administration has assembled a team to find long-term solutions for shoring up the pharmaceutical supply chain at a time when the United States remains heavily reliant on medications and drug ingredients from India and China. And in recent weeks, generic drug makers, supply chain experts, and patient advocates have appeared before lawmakers to discuss the problem. When have these drug companies ever ran out of drugs, man? They always got pills popping. They always got medication to give because it's a big industry. It's a billion-dollar industry. Now, all of a sudden, they're short on supply. Like I said, it just sounds fishy. And a lot of it sounds manufactured because remember, there is an agenda, man. There is a plan to bring order out of the chaos. There is plans to get rid of a lot of you people out here, man. And there is a plan to get, to leave you people so desperate and so hurt that you're going to have to come to your government and you'll be willing to sell your soul and do whatever you need to do in order to get your fix or to get, things that you may need to save your life or a loved one. It says the scarcity of generic forms of chemotherapy to treat lung, breast, bladder, and ovarian cancers have only heightened concerns. This is, in my opinion, a public health emergency, said Dr. Amanda Fader, a professor at Johns Hopkins School of Medicine and a president-elect of the Society of Gynecologic Oncology. Because of the breadth of the individual it affects and the numbers of chemotherapy agents that are in shortages right now. So what does that mean? Eventually, they're going to have to just let a lot of people who need this therapy and these different treatments, but they don't have the medicine. A lot of them are going to have to just, be left out in the cold. It's going to have to be on a case-by-case basis, It says the American Cancer Society last week warned that delays caused by the shortages could result in worse outcomes for patients. So imagine how much more of a shortage is going to be when America goes to war with China. You think China's going to be still shipping those drugs here to America while they're in a hot war against each other? You think a lot of these import and exports from different countries are going to be able to get here and make it to the hospital so that people can be treated? These things you got to think about, which is why, like I said, it's going to be great, desperation, great death, great anxiety, great depression, great pain and suffering and sorrow, coming here in the near future, It says that's the bottom line. These aren't third or fourth line drugs where there are multiple other agents around. These are used up front for people you are trying to cure. You see, it talks about some guy. It says Ryan Dwars beat pancreatic cancer in 2021, but late last year a scan showed cancerous spots on his liver. Mr. Dwars, 39, and a faith father of two young girls, had hoped to receive his final 4 doses of chemotherapy in April. Then his doctor delivered stunning news. He didn't make the cut of those given priority for treatment, you see. So all these sick people out here, if you don't meet the priority for the treatment, guess what? You're not going to get it. And what's going to happen? Eventually, you're going to just have to, prepare for the, for the worst. It says the light at the end of the tunnel was within sight, said Mr. Dwyers, a special education teacher in Iowa City, said it made it even worse to be so close and now this. And what do you think that's going to do to that guy? You don't think he's in despair? You don't think he's hurting? You don't think he's depressed, having anxiety? You don't think he's considering, he might have to just, take matters into his own hands and just, take himself out if it gets too bad and the pain gets too horrible, too hard to take. He's not going to be left with many options here on the table, man. You see? What else is in here? It says officials have been debating possible measures like tax incentive for generic drug makers and greater transparency around generic drug quality. The current incentives favor drug makers with the lowest prices, which include those that might cut corners, leading to disruptive plant shutdowns if the FDA demands a fix. What else? There's not really more in here. Yeah, it says shortages are on the rise. We've all seen that. So now they're coming up with all these generic drug makers, which those generic shit ain't gonna do shit. It may, put a band-aid on it, but it's not gonna stop the whole situation. It says hospital pharmacists and supply chain experts were stunned in February by the abrupt shutdown of Acorn, whose products were then recalled since there was no staff remaining to address potential quality concerns. That added insult to injury, said Eric Tichy, a supply chain division chair at the Mayo Clinic and the board chairman of the End Drug Shortage Alliance. Acorn made roughly 100 medications, including cylinders of albuterol, that children's hospitals had relied on to ease their breathing difficulties, and it was only company that made an antidote to lead poisoning. See? So a lot of people are about to be suffering. A lot of these children are about to be suffering. A lot of those children at the St. Jude Hospital are going to be suffering, and just the average person in general. You see? And that's why at the end of the day, a lot of these drugs, man, really don't cure you. It just basically treats the situation, which is why the Lord made drugs out of the earth, man. Drugs that heal, that make you whole. This, our patients are in a war, and what we're doing here is we're taking their weapons away. It's completely ridiculous that we can't figure out a way, at least in the short run, to get our patients treated and in the long run to serve these recurring problems. When Ms. Bray met with White House staff members in late April, she said that she recommended creating an exchange to get drugs where they were needed most and increase the production of small batch medicines, blah, blah, blah. Wait, but it's not going to happen, man, because really, a lot of this shit is being orchestrated, and a lot of this is being done intentionally, man. Like I said, the other few reasons why they would want to do this is ultimately is to gain control over the population, man. And one way that they can do that is by bringing fear, chaos, fear, anxiety, desperation, and the lack of anything, man, will make anybody do things that they wouldn't normally do if they weren't in that situation, which these devils are, going to eventually put the clamps down on everything. And, and a lot of this is going to lead to terrible times here in Babylon the Great, man. And I was reading another article, too, where they said the depression rate here in America is rapidly growing, man. So imagine people are already depressed and bugged out and down and out. Imagine when this, shortage becomes, no longer a shortage, but it's just going to be stopped, and people are not going to be able to receive these things, as they readily need them. It's going to cause a lot of bad times, man. It says, 2 Ezra 16:19, it says, behold, famine and plague, tribulation and anguish are sent as scourges for amendment. See? This is really, the left hand of Yahweh Bashem Yahushua, where the Lord's going to punish 2/3 of our wicked ass people and these people of this earth, man. It says, but for all these things they shall not turn from their wickedness, nor always be mindful of the scourges. It says, behold, victual shall be so good cheap upon earth that they shall think themselves to be in good case, and even then shall evils grow upon the earth, sword, famine, and great confusion. Yeah. You don't think it's going to be great confusion when, all these people who are dependent on these drugs no longer going to be able to get even a little bit of what they used to get? When a lot of these people who are dying of cancer and need cancer treatment and chemotherapy and these life-saving medications are not on the priority list to get them, you don't think that's going to cause great confusion and desperation? People are going to absolutely go fucking crazy, man. People are going to be invading one another. People are going to be, going out here, in all desperation and and all anger and and vengeance on their minds, man. And some people, like I said, a lot of people are going to just have to off themselves, man, because they're not going to be able to deal with the reality that they're not going to receive these life-changing drugs. They're going to be in so much pain and so much anguish and so much depression that the best option for them would be to take their own lives, man. It says, for many of them that dwell upon earth shall perish of famine, and the other that escape the hunger shall the sword destroy. You see? And that's more of those shortages. And we know that famine is coming here. We know that crops aren't being planted as they were in years past, you know? So it's going to get very dire out here pretty soon. It says, and the dead shall be cast out as dung, and there shall be no man to comfort them. You're right. So, like I said, when people that are sick as hell can't receive these medications and these life-saving drugs, who the hell going to be able to comfort them? There's not going to be no words or no things that you can do or give them that's going to comfort them, especially these people who have very high stage cancers or certain life-threatening sicknesses, man. And the only thing that was, taking away the pain and keeping them able to cope with it was these medications are no longer there. Come on, man. You ain't gonna be able to comfort no guy like that, man. He's just gonna want to just, go back into the spirit world, man. It says, read that again. And the dead shall be cast out as dung. Right. There ain't gonna be no coroners coming. There ain't gonna be no funeral homes open when all hell breaks loose. And they pull the plug on Babylon. And there's no, the dollar ain't good no more. You got the power outages. All hell is breaking loose and anarchy and sedition going on. Who the hell is going to be out here burying these dead bodies, man? You're not going to have the ambulance running around, answering to every violent and death that's going to happen out here on the streets. People are just going to be laid out here like dung on the street, stinking, decomposing, while all hell is breaking loose. It says, and the dead shall be cast out as dung, and there shall be no man to comfort them, for the earth shall be wasted, and the city shall be cast down. There shall be no man left to till the earth, right? No more farming, which they're doing away with that shit right now. It says, and to sow it, the trees shall give fruit, and who shall gather them? The grapes shall ripen, who shall tread them? For all places shall be desolate of men, so that one man shall desire to see another, and to hear his voice. For of a city there shall be 10 left, and 2 of the field, which shall hide themselves in the thick groves and in the clefts of the rocks. Right? Because people are not going to want to be seen out here, man. Because people are going to be so desperate and so perplexed and so goddamn crazy and be in that maniac mode, man. People are going to be hiding out, man. You're not going to want to show your face because, you're going to be worried about what the next man, is going to do to you or want to take from you. You see? It's going to be crazy as hell out here, man. It's going to be a lot of death, a lot of destruction, a lot of sad faces out here. But as you can see, it's ramping up, man. And this drug shortage ain't no joke, man. It's a lot of people out here dependent on this shit. And when it's gone, it's going to be gone, man. And you're going to see the true nature of people that are desperate and people that are, living beyond the edge, man. And, hey, that's why we got to continue to, repent, man. Pray that Yahweh Bashem Yahushua is with us on every level of this coming time of Jacob's trouble, because there's going to be Jacob's trouble on every level, man. And hey, and if the Lord is with us, then who can be against us, man? That's our shield and buckler. That's our only way out of this. That's our light, our shining light in the darkness, and our guide in the midst of all this chaos that is being manufactured and cooked up out here, man. So we just want to make sure that we're on the right side of it, man. But hey, 2/3 of our people and the rest of you people out here, man, hey, you're gonna have to suffer these things, man. Maybe not you directly, but maybe your family member, a loved one, somebody is going to be affected by this when it really hits the fan, man. But we want to make sure that we're going to be on the right side of this, man, with Yahweh Bashem Yahushua. So with that, Lord willing, you were edified. Call hello Yahweh Bashem Yahushua, put the spirit of me to do this lesson. Lord willing, you were edified. Shalom.